Hello, dear viewers. Today we are going to discuss a topic that has affected all our lives: the current state of the coronavirus in 2025. I know many of you have questions about how things have changed over the years, so let us dive right in. The pandemic has fundamentally transformed our society in profound ways. Remote work has become a permanent fixture for millions of Americans, allowing greater flexibility and work-life balance. Many businesses have embraced digital transformation, adopting new technologies that make operations more efficient. We've learned to appreciate simple things like face-to-face meetings and family gatherings. Video calls have become an integral part of our communication, helping us stay connected with loved ones who live far away. The medical field has made incredible progress over the past 5 years. Vaccine technology has advanced dramatically, with numerous vaccines proving highly effective. Telemedicine has become mainstream, making healthcare more accessible. Hospitals are now better prepared for mass emergencies, and respiratory care has improved significantly. Diagnostic tools are faster and more accurate, while personalized medicine has advanced, allowing tailored treatments. Public health infrastructure has been strengthened, giving us the capability to respond more effectively to future pandemics. The pandemic has introduced lasting changes in social behavior. Hand sanitizing stations are now common in public places, and flexible sick leave policies have become standard in many companies. Indoor ventilation is now a priority in building design, and public health awareness has increased significantly. We've become more mindful of personal space in social settings and have adopted more rigorous hygiene practices. These changes have made us a more health-conscious society, with a greater understanding of disease transmission and prevention. People over 50 have become more proactive about their health. Regular checkups are now a priority, and preventive care has gained importance. We've learned to recognize symptoms earlier and take better care of our immune health. Mental well-being is now recognized as crucial, and we've become more conscious of the importance of nutrition and exercise. Chronic disease management has improved, and we're more attentive to our overall health. As of 2025, the virus behaves more like a seasonal flu. Transmission patterns are better understood, and severity levels have generally decreased. Vaccine effectiveness remains high, and treatment options are more advanced. Public immunity is higher due to widespread exposure, and healthcare systems are better prepared. Global surveillance is more robust, allowing us to track and respond to outbreaks more effectively. The Lambda variant is currently most prevalent. It has a higher transmission rate than previous strains, but generally causes milder symptoms. Vaccines remain effective against it, and treatment protocols are well established. Recovery time is shorter, and the incidence of long COVID has decreased. Pediatric cases are better understood, and medical experts have developed targeted treatments for different variants, making it easier to manage infections. Let us talk about how to protect yourself in 2025. Staying current with boosters is crucial, especially for those over 50. Wearing high-quality masks in crowded places remains important, especially during periods of high transmission. Maintaining proper hand-washing practices and ensuring good airflow in indoor spaces are essential. Knowing the early signs of infection and getting tested if you experience symptoms can help you take quick action. Living a healthy lifestyle is more important than ever. Eating a balanced diet, exercising regularly, and managing stress can boost your immune system. Practicing social distancing when necessary and considering immune-supporting supplements and vitamins can also help. Staying connected with your doctor and following their advice is crucial for maintaining your health. Now, let us address some common myths about COVID-19. One myth is that the vaccine can give you the virus. This is false. Dr. Kizzmekia Corbett, a leading vaccine researcher, confirms that the vaccines do not contain live virus and cannot cause infection. They teach your immune system to recognize and fight the virus. Another myth is that masks don't work. This is incorrect. Public health experts agree that masks significantly reduce the spread of respiratory droplets, protecting both the wearer and others. Dr. Lena Wen emphasizes that masks are a simple yet effective way to reduce transmission. Some people believe that COVID-19 only affects the elderly. While older adults are at higher risk, younger people can also become severely ill. Dr. Monica Gandhi emphasizes that long COVID can affect people of all ages, and everyone should take precautions. Another common myth is that natural immunity is enough. Medical studies show that vaccination provides more consistent and durable protection than natural immunity alone. Dr. Anthony Fauci advises that relying solely on natural immunity is risky and that vaccination offers the best protection. Some people think that COVID-19 is just like the flu. While they share some similarities, COVID-19 can be more severe and has different long-term effects. Dr. Helen Chu explains that COVID COVID-19 can lead to more serious complications and long-term health issues compared to the flu. It is important to understand that while both are respiratory illnesses, the impact of COVID-19 on the body can be significantly different and more severe for many individuals. Let us talk about some of the lesser-known effects of the virus. Many people are now familiar with the concept of long COVID, which refers to symptoms that persist long after the initial infection. These can include fatigue, brain fog, shortness of breath, and joint pain. Dr. Monica Gandhi has been studying these long-term effects and emphasizes that they can affect people of all ages, not just the elderly. One of the most significant changes in healthcare is the way we approach respiratory illnesses now. Hospitals have invested in better ventilation systems, improved air filtration, and more advanced monitoring equipment. This has not only helped with COVID-19 but has also improved care for other respiratory conditions like pneumonia and asthma. The way we think about public health has also changed dramatically. Communities now have better systems in place for tracking disease outbreaks, distributing medical supplies, and communicating health information. Local health departments work more closely with hospitals and clinics to ensure a coordinated response to any health crisis. Mental health has become a much bigger focus in the healthcare system. Many of us experienced increased stress, anxiety, and feelings of isolation during the pandemic. Health providers now offer more mental health services, including teletherapy and support groups. Dr. Lena Wen stresses the importance of addressing mental health as part of overall wellness, especially for older adults who may feel more isolated. When it comes to protecting yourself, it is important to stay informed about local conditions. Health officials recommend checking local transmission rates and adjusting your precautions accordingly. This might mean wearing a mask in certain situations, even if you are vaccinated, especially in crowded indoor spaces or during times when cases are rising. Nutrition plays a crucial role in maintaining a strong immune system. Eating a balanced diet rich in vitamins and minerals can help keep your body strong. Foods high in vitamin C, like citrus fruits, and foods with zinc, such as nuts and seeds, can be particularly beneficial. Staying hydrated and maintaining a healthy weight also contribute to overall immune health. Exercise has become more important than ever. Gentle activities like walking, yoga, and Tai Chi can help improve circulation, boost immune function, and reduce stress. Many gyms and community centers now offer senior-friendly exercise programs that take into account the specific needs of older adults. Sleep is another critical factor in maintaining good health. Aim for 7-8 hours of quality sleep each night. Establishing a regular sleep routine, creating a comfortable sleep environment, and avoiding screens before bedtime can all help improve sleep quality. Social connections remain vital for our well-being. While we've learned to be more cautious about in-person interactions, it is important to stay socially engaged. Virtual meetups, phone calls, and outdoor activities with friends can help combat feelings of loneliness and isolation. Let us talk about some of the new treatments available. In addition to vaccines, there are now antiviral medications that can help reduce the severity of symptoms if taken early. Monoclonal antibodies and other targeted therapies are also available for high-risk individuals. Home care has improved significantly. Many healthcare providers now offer remote monitoring, which means they can keep an eye on your vital signs and overall health without you having to leave home. This is especially beneficial for older adults who may have difficulty traveling to medical appointments. Travel has changed too. While we can now travel more freely, it is important to be prepared. Having a supply of masks, hand sanitizer, and any necessary medications is still recommended. Checking travel advisories and health guidelines for your destination can help ensure a safe trip. Workplace safety has evolved. Many offices now have improved ventilation systems, hand sanitizing stations, and flexible work arrangements. Employers are more aware of the need to support employees' health and well-being, offering options like remote work and more generous sick leave policies. Education has also been impacted. Schools now have better health protocols in place, including improved ventilation, easier access to hand sanitizer, and more flexible learning options. This benefits not only students but also teachers and staff, many of whom are older adults. Community support networks have grown stronger. Neighbors and community groups are more connected, often helping each other with grocery shopping, medication pickups, and other essential tasks. These networks can be invaluable for older adults who may need extra assistance. Healthcare communication has improved. Doctors and nurses now have better tools for explaining conditions, treatments, and preventive care. They often use visual aids, simpler language, and more time to answer questions, ensuring that patients fully understand their health situation. So, let us summarize. Although the pandemic is over, the COVID-19 virus itself will remain in our world forever. It is not as dangerous now as it was during the pandemic, but we still need to be wary of it and consult a doctor immediately if we get sick with it. I hope this information helps you feel more prepared and less anxious about the current situation. Please share your thoughts in the comments below, and don't forget to subscribe for more updates on health and wellness. Take care of yourselves and each other. Together, we've come a long way, and together, we'll continue to navigate these challenges. Thank you for watching. Stay safe and healthy.